IUDs, not just for contraception anymore. Welcome to Talking with Docs. I'm Dr. Paul Zalza.
I'm Dr. Brad Weening.
And I'm Dr. Sandy Andrighetti.
Dr. Andrighetti is an obstetrician gynecologist who's joined us here. And thank you so much, because I think if Dr. Weening and I tried to tackle the topic of IUDs on our own, I don't think we would do it justice.
Right, so what we're going to talk about today is the history of IUDs and what they're used for. And historically, they were used to prevent pregnancy, but they have many, many uses to help women through many complicated problems. So let's start at the beginning. What is an IUD? And thanks for joining us.
What does it stand for?
Intrauterine device. We actually now change it to intrauterine system because it sounds a little bit sexier than intrauterine device.
IUS.
So IUS is a system, but it started out as just an IUD, and the one that got the worst rap was the Dalcon Shield. It kind of looked like a little spider, and the reason it got a bad rap is because there was a lot of infections. It was a device problem, right?
They said the string had too many filaments and bacteria could migrate from the outside to the inside.
Right, so they changed that, and then rebranded, remarketed, and IUDs have been used internationally for years and years as a great way to prevent pregnancy.
Okay, so let's start with pregnancy. Are they effective?
Yes.
How effective?
So really effective. There's two kinds. There's ones that are copper, very effective, but a little bit less than the medicated ones, which have progesterone in them.
What are the numbers here? Are we talking about like 80%, 90%,
90%.
More than 90%.
Yeah,
effective.
Approaching 99. Like I can think of 3 pregnancies in my 20 years, 26 years with an IUD. Yeah.
Okay, that's
so I think that's a useful piece of information. So not 100%.
Nothing.
So you may want to consider a second option as well.
Yep.
But very, very highly effective. Okay, so you mentioned that there are 2 types.
And it doesn't protect against STIs, right?
Okay.
So that's the other thing.
Whole separate issue.
Whole separate issue.
Sexually transmitted infections, you won't be protected from one of those using an IUD. Important to
Right, some people think that it would protect you, but it doesn't.
Okay.
Mm-hmm.
So what's the difference in the way that they work? So you said that there's a copper one and that there's a medicated one. How do they work differently?
So copper just makes a tremendous inflammatory reaction, which is, cover your ears, hostile to the sperm.
Okay.
Hostile to the sperm, and just prevents implantation is its main reason. Okay. And the other one works by changing the mucus a little bit and making the lining of the uterus super thin.
Okay.
So the copper ones, not unlike the copper bracelets that people wear in our office?
That's right, different
idea.
Copper, yeah, different. But reduces inflammation. Yours reduces inflammation.
Ours
causes inflammation.
Yeah, interesting. Okay, so first one is to reduce pregnancy. What's the second reason that someone would consider having an IUD?
A big one is emergency contraception. Okay. So if you find yourself having an unplanned, undesired pregnancy and your contraception failed or you didn't use it, we can use IUDs for up to 5 days. The copper ones only, not the medicated ones.
Okay, there's a 5-day limit on that one. Beyond 5 days?
Sometimes up to 7. Will even, depends on the further out you get, the less effective, but it can be useful when things like Plan B no longer work.
Okay.
Plan C here.
Plan C, exactly.
Okay, so number 2 is unplanned pregnancy. Number 3, heavy periods, correct?
Yes.
And this is a very common problem.
Huge, and that's why we're calling it an intrauterine system, because we want people to know that it's not just for contraception.
Okay.
And people almost back off immediately. They say, well, I don't want anything in my uterus, I don't want that, but I'd like you to help solve my problem of flooding and really heavy periods. And sometimes even the tissue can change that can, if left untreated, can lead to a cancer. So we use it for something called hyperplasia.
Okay.
It's great for that because it can help reverse that little bit of progesterone. So the progesterone is delivered locally as opposed to going through your bloodstream and traveling. I call it the Costco of delivery systems. Straight to the consumer.
Straight to the consumer. Nice. Remove the middleman.
Remove the middleman, which is your liver, right? Yeah, you remove your liver.
So the IUD, now known as IUS, as everyone commonly thought, it was to reduce the risk of pregnancy, but now also we're talking about reducing heavy menses, and even possibly risk of cancer in these settings?
Exactly, yeah. So we use it to reverse something called hyperplasia, which we traditionally used to give people oral progesterone, so now we can just deliver it.
Okay.
Nice.
And then we're also using it for hormone therapy. So a lot of women who have terrible hot flashes that can't manage without estrogen, rather than taking estrogen and progestin by mouth. So we're reducing our hormone. We always want to reduce exposure to hormones and achieve the highest benefit.
Right.
So one way of doing that is we can put the IUS in the uterus and just give them the estrogen by mouth, and then we're cutting out, exposure of hormones. And people are hormone averse for good reason. There's lots of media attention, but hormones are great when we need them because they help manage our symptoms.
Okay. Now we talked about the device itself. How does someone go about getting one of these?
So they're mostly covered by third-party insurance if they're medicated. If they're non-medicated, they don't have that drug identification number, so you have to pay for them.
So you mean the copper ones you have to pay for?
Correct, and they
Okay.
run about $100, and there's different kinds. There's some for people who've never had a baby, or the nullip one. There's some that are 5 years. Then there are some that are 10 years.
Okay.
So 10 years are a really good return on your investment because it's $100 for 10 years. That's pretty reasonable.
Yeah.
And then the IUS, there's two in Canada now. There's one called Kylena, which is a little bit smaller, good for 5 years.
Okay.
And that's usually what we use for women who've never had a baby, our like adolescent population.
Right.
And then there's one that's called Marina, which is less off market or on label 5 years, but off label 7 years. And we've been telling patients for a long time that it's good for 7 years off label. And with COVID, the Society of Obstetricians actually endorsed us now that says we can tell them 7 years. Some of the data says 8 years.
Wow.
And on the costs, like everything in healthcare, and every time we talk about costs related to healthcare, it varies with your region. Okay, these are sort of the
Right.
local costs in our area, but where you live, it might be more expensive, might be less expensive, might be covered by your insurance, may not be covered by insurance.
Exactly.
Where is this done? Where is this inserted? What's involved in the process itself?
So it's mostly done in doctors' offices
Okay.
by healthcare providers. So either family doctors, some midwives are training. It doesn't have to be an obstetrician, sexual health clinics, lots of places. And
Right.
if you do a lot of them, it's pretty simple.
How long does it take?
It takes about, well, it depends on the person doing it. The provider takes about 3 minutes.
Okay, so it's relatively quick.
Done
Is
in
it
my office.
Is it uncomfortable?
It can be uncomfortable, so I have everybody take Advil or Tylenol before,
Okay.
if they're not allergic.
And then they just get up, they walk home.
Yeah, sometimes the recommendations are to wait 15 minutes in the doctor's office.
Yep.
Most of my patients are like, I got a bail, can I go? And I
Sure.
say, sure.
Walk it.
But yeah, it's a pretty quick. Some places do it in the hospital.
All right.
Some of my colleagues do it only in hospital.
Okay.
Wow, so that's a summary of it, man. That's everything you want to know about IUD, now known as IUS, the multiple uses, how you get it, how you get one implanted. It's really like a Swiss Army knife. Lots of different uses.
Yeah, and it's not something that has to stay in the whole 5 years. That's the only thing. If you hate it, we pull it out.
Right, because there's a little string attached to the device
Tiny little
itself.
string. So people think it's, I don't want this in my body. I don't want
Right.
it's not like a filling, you don't need a drill. You just pull a little string and out it comes.
Every treatment we do has a chance of risks and complications. What are some of the risks associated with an intrauterine system?
So the risks are, it can cause some irregular bleeding for up to 3 to 4 months while it's settling in. Some people up to 5 months.
Even though it's a treatment for bleeding, ironically.
Right, just like the birth control pill we use as a treatment for bleeding, but it doesn't work straight away.
Okay.
It takes a time just for that process, just to start thinning out the lining.
Okay.
There's always a risk of infection whenever
Yes.
we do anything. Risk of expulsion, which means you can spit it out or your body can reject it.
Right.
I say that's kind of like a contact. Your contact can go flying out sometimes. And there's a risk of pregnancy. Those are the 4 big ones. Perforation is the other tiny little risk, which is...
During insertion, theoretically
Correct.
that thin little device could go through the wall
Correct.
of your uterus.
Yeah.
Now, in the field of contraception, competing with condoms, competing with the pill, where does the intrauterine system find itself? Is it becoming more commonly used than the pill, less commonly used?
It's definitely becoming more commonly used. Sometimes it's just trying to educate people about what it's about. But it's much more commonly used from a cost-benefit ratio. It's much, much higher. From a loss of menstrual flow, like people are saving lots of money just on tampons and pads alone because they almost have no periods.
Right.
And people are becoming more hormone aware or hormone averse and don't want to take pills. They can't remember. They have busy lives. So the whole set it and forget it
Right.
is an amazing thing. Like I have people who forget they have it in. And they're coming in at 10 years and say, can you just check and see
Oh,
when
wow.
you put that IUD in? Because they're not having any periods or very light periods and they love it.
Right.
So you think it's gaining popularity in
Oh,
use?
for sure. Absolutely.
Okay.
I have 2 more questions.
Sure.
One, there's a myth that it can cause infertility. Can we debunk that?
Yes, 100%.
Right.
So if you have an infection, so
Sure.
if you have unprotected intercourse and exposure to STI, for sure.
Right.
We don't even take out an IUD anymore if you're positive for chlamydia. We
Right.
just treat the chlamydia or gonorrhea, which are very common infections.
Right.
We used to in the old days immediately retrieve it. We don't do that anymore.
Right. Okay, and then the second one is, how do you know when it's not working anymore? So even if it's there,
Right.
it's in the proper position, the last thing you want is to get pregnant and say, oh yeah, I guess your IUD
Exactly.
kind of had worn out or
I
whatever.
think that's your clue, Dr. Wheating.
I know,
You
but
got pregnant.
but how does someone know before
What prevention?
that
We're
happens?
about
Right, so
prevention.
we're talking about prevention. So
Yeah.
someone's like, listen, I'm nervous or I have a busy
Yep.
life or for whatever reason I don't want to get pregnant and I've had it in for 4.5 years. How do I know? I'd maybe like to get
So
it
if
changed
it's
sooner.
the progesterone one, you'll start bleeding. So everybody wears out of medication quicker. If it's
Okay.
worried about movement or expulsion, we always teach people to put 2 fingers in their vagina and feel for their cervix.
So you can do self.
Your cervix feels like the tip of your nose, and I say feel for the opening like a nostril, and you should feel 2 little wires like a fishing wire.
Right.
When I insert it, I actually give them the fishing wire ends that I cut
So they can
so
feel
they can
it.
know what they're feeling.
That's a good idea.
Yeah.
Wow, we've learned a lot this morning and it is early still.
Yeah, I don't think we could have covered this on our own.
I don't think so. That was wise to bring in an expert for us for sure. Thanks so much for joining
No
us,
problem.
Santina.
Thanks for having me.
Guys, if you like this video, please like it, subscribe to our channel. Please leave your experience with an IUD or with contraception or any thoughts about the video.
And thank you so much for joining us.
Of course.
That's the point of this channel, is to talk about things that for various reasons, for a variety of reasons, you can't access a healthcare professional to talk about. Here we have a professional, and you just heard everything you want to know about the intrauterine system. You are in charge of your own health.
See you next time.